Sadness is a normal human emotion. We all experience it from time to time. It's a natural response to loss, disappointment, or hardship. Sadness is usually temporary. It fades as we process our emotions and cope with the situation. Clinical depression is different. It's a serious mental health condition. Depression is not just feeling blue. It's a persistent state of sadness and despair. This can last for weeks, months, or even years. Depression affects thoughts, feelings, and behavior. It interferes with daily life. Work, relationships, and even simple tasks become difficult. It's important to remember that depression is not a sign of weakness. It is a medical condition that requires professional help. Clinical depression manifests in various ways. Psychiatric guidelines outline specific symptoms for diagnosis. Experiencing 5 or more of these symptoms for at least 2 weeks may indicate depression. These symptoms are persistent low mood, loss of interest in activities once enjoyed, significant changes in appetite or weight, feelings of worthlessness or excessive guilt, sleep disturbances, insomnia or oversleeping, difficulty concentrating or making decisions, fatigue or loss of energy, restlessness or feeling slowed down, and recurrent thoughts of death or suicide. Depression doesn't just impact our minds, it has physical effects on the brain. Studies show that people with depression may have smaller frontal lobes and hippocampi. These brain regions are crucial for emotional regulation, memory, and decision-making. Depression also disrupts the delicate balance of neurotransmitters. These are chemical messengers in the brain. Serotonin, norepinephrine, and dopamine are key neurotransmitters involved in mood, motivation, and pleasure. The exact causes of depression remain unknown. Research suggests a complex interplay of factors contributes to its development. Both genetic predisposition and environmental triggers play significant roles. Genetics can make some individuals more vulnerable to developing depression. If a close family member has a history of depression, the risk may be higher. However, having a genetic predisposition doesn't guarantee you'll develop depression. Environmental factors also play a crucial role. Traumatic life events, chronic stress, and social isolation can trigger depression in susceptible individuals. These experiences can alter brain chemistry and increase the likelihood of developing the condition. It's important to note that there's no single test to predict who will develop depression. It's a complex condition with multiple contributing factors. Seeking treatment is vital for overcoming depression. Unfortunately, many people suffer in silence for years before reaching out for help. The stigma surrounding mental health often prevents individuals from seeking the support they need. Effective treatments for depression are available. Medications such as antidepressants can help regulate brain chemistry and alleviate symptoms. Therapy, particularly cognitive behavioral therapy, CBT, equips individuals with coping mechanisms and helps reframe negative thought patterns. Supporting someone with depression can make a world of difference. Encourage your loved one to seek professional help. Offer practical assistance such as finding therapists or making lists of questions for doctors. Remember to be patient and understanding. Recovery from depression takes time.